Then let's move on. Our first staff update at the briefing is on COVID-19 and vaccinations, and Stacy Saunders is here to present this item.
Good afternoon.
Good afternoon.
So we'll do our regular COVID update for you all with our vaccine rollout update at the end. And 17,051 confirmed COVID-19 cases have been identified in Buncombe County to date. We have now experienced 313 COVID-related deaths in our community. And currently, we are seeing about 30 new cases. Apologies. 30 new cases per day enter our public health workflow. This is a slight uptick from the last 3 weeks. Also, as indicated by our new cases per 100,000 per week, increasing to 97 this week. And today, just today, we added about 14 new cases to the workflow, and the new cases per 100,000 for today went to 94. COVID-like illness surveillance, one of our early indicators. I apologize. One of our early surveillance indicators actually did show an uptick in the week ending April 10th, which was then followed by a slight uptick in those new cases just last week, at the end of last week, where we were seeing closer to 30 cases each day. While the overall Epi Curve appears to be relatively flat, there is evidence right at the tail end of just a slight uptick, as I had mentioned. Our percent positivity has remained stable over the last week, ranging from 4.0 to 4.5, the average being 4.2, and this has been stable for now several weeks, 3 or 4 weeks now. And today's value is 4.1%. This indicator, as I said, has showed much stability over time. Our regional hospitalization, those continue to remain low and have seen even a decline in the last week. I apologize, this is the COVID-like illness surveillance, and you can see still relatively low, but we did see a slight uptick. I'm sorry, Max, these are the slides from the week before, I just noticed. Okay. So I'm just going to talk through them then, because they're not reflecting actually what I'm saying. I just noticed that that with the COVID-like illness, actually it's showed an uptick in the week. Okay. An uptick in the week ending April 10th. And so that's one of our early indicators, so that we see those COVID-like illnesses first, and then likely if you did see an uptick in that, it's likely then followed by new cases, and we did see that. Our testing numbers, make sure, because the next one is the metrics that you all like to see, and the metrics monitored weekly continue to, thank you, Max. There you go. Thank you. So you can see that COVID-like illness just coming up slightly from that very low level the week ending April 10th. And then the percent positivity has remained very stable. Again, the hospitalizations starting to decline even further. And then here are the metrics that we follow each week and report to you all. The metrics monitored weekly continue to show overall stability. Our new cases per 100,000 per week last Monday was 72, and this past Monday was 97, as indicated, as I previously indicated, and that uptick in new cases. And so you did see that increase. The percent positivity remained well below 5 and remained in that 4 to 4.5 range. Yesterday it was 4.1 when we pulled the data for the week to week. So that actually saw a decline. Our testing numbers did not change significantly from one week to the next, and the deaths remained the same as well. And our local hospitalizations, not the regional data that I just showed you, but the local hospitalization trends have not changed significantly in the last week. As you can see here, it went from about 3% to 2.8, so low and stable. And then the percent ICU beds occupied with COVID-19 is still very stable. And just of note, the percent of ICU beds occupied with COVID-19 is at levels that are so low and stable that the hospital system is no longer routinely updating that data for us, but will reinstate that should we start to see that increase. So this will be the third week, I think, of me talking about sort of a flat landscape. Overall favorable indicators, but it's also, I want to say that it's also the third week that I'm cautioning everybody that we are not continuing to decrease. While we are not increasing significantly, that is a very good sign, but we are also not decreasing. And so it's the third week I'm saying I'm concerned about this plateau, and that, I want, while it's encouraging for us to maintain that overall stability, I'm concerned with the stagnation that we are seeing in the indicators. And particularly the end of last week when I saw just the new cases increase just slightly into the 30s. I'm encouraged to see that today it was back down into the teens, but I would like to see that remain. And so I would not want us to experience what other communities are experiencing right now across the nation, where they're seeing much higher increases. So I'll soon discuss the vaccine efforts, and I hope each of us will get our vaccine now, that it is open to everyone, and vaccine supply is quite ample now between state and federal vaccine providers. And as we continue to vaccinate, I want to remind everyone that our best chance for our community, for each of us to get back to doing the things that we love, like travel and hugs with families and singing along at our favorite concert venues with our favorite bands and all the other things that we missed in the past year, the best way to do that is to get your shot. We all now have a spot, and there is vaccine supply in many locations within our community. So there is no need to wait. Please get your vaccine today and begin protecting yourself, your loved ones, our community, and our economy. So with that, I just want to remind folks that they can visit the North Carolina DHHS website for vaccine providers, myspot.nc.gov. And as mentioned, everyone 16 years and older is now eligible for vaccine. And just a reminder that those who are 16 and 17, that only Pfizer is the only vaccine at this point that has received EUA for those who are less than 18. And so when you're making your appointment, be sure to check with your provider about what type of vaccine is being given out. I do want to take a moment to highlight again the vaccine efforts of not just our health department, but all the vaccine providers within our region. I showed you all this the last time I was with you. The national map shows that vaccine work. It's been a concerted and a collaborative effort between health departments and hospitals and community health centers and pharmacies and many other providers within this region to have us standing out so significantly. And so many thanks for their efforts and yours as supportive leadership of those vaccine efforts. And so as of yesterday, our state has administered over 6.5 million total doses of vaccine. This translates to over 37% of the population receiving at least one dose of vaccine, and just over 27% now receiving their full complete series and being fully vaccinated. This includes all providers. This map that you're seeing here, that's the North Carolina and the federal pharmacy partners all in here. And just to note, there we are standing out in a dark blue, so very favorable with our vaccine rollout. I also wanted to say here that for this is the North Carolina dashboard for vaccine progress, and share that Buncombe County as a whole is showing about 43% of people vaccinated with at least one dose of vaccine, and 31% of people fully vaccinated with their complete series. So we're making very good progress. For our.
Hey, Stacy,
Sorry.
I'm sorry, I have a question. When I've heard those numbers of like, they've gotten both or they've gotten one, and it's these percentages, I've always had a little trouble interpreting that. So like, for example, in Buncombe County, where we've had 43% get at least one, and then 31% have gotten fully vaccinated. So what percentage of the population has gotten either one or fully vaccinated? You understand my question?
Yeah, so I've had the same question, and my
Okay.
understanding is the language of at least partially vaccinated is inclusive.
Of the full.
Of the other group.
So 43% has either gotten one or fully.
Yes.
Thank you very much.
And then the other number is just fully.
All right, so you don't add those two together, you just take the bigger number and that's it.
I wish we could add those together and show that we had that
Okay.
much progress, but no,
Okay.
that is my understanding of the use of that as well.
Thank you very much.
Yes, you are very welcome. And so for our local health department efforts, Buncombe County HHS and our partners at Emergency Services have administered over 77,660 total doses, with roughly 43,200 of those being first doses, 33,000 being second doses, and just under 1,500 being the single shot doses. So I did want to reintroduce you all to the vaccine demand curve that we've been monitoring. I introduced this the last time I was with you, and as I mentioned last time, we saw a large demand early on when we had very little supply, and we had implemented the wait list at that time. We saw demand taper until, around March when broader groups were being introduced. And we introduced the online scheduler late last month as we completed the wait list, and that's that orange line that you're seeing where they they're overlapping just a little bit. And we've been tracking that as a proxy for demand since finishing the wait list, and we can clearly see a decline in demand over time, even with the vaccine eligibility opening up to much larger groups. We are not seeing the same surges in appointments that we were seeing early on. And for the last couple of weeks, we've seen about 2,000 appointments uptake per week. Today is a very different day than when we started several weeks ago. And as mentioned early on, there was very limited supply, very few providers, and a very eager prioritization group of our 75 years and older who wanted vaccine. Today, our landscape looks quite different, and we have ample vaccine supply coming through both the North Carolina providers and the federal pharmacy providers. We have many more vaccine providers, not just in our community, but just in the region as a whole. And we are seeing that shift to more of a convenience-driven decision-making. And that brings me to my next slide. So as demand has waned, anecdotally from providers, from partners, and consumers alike, we are noticing a switch to valuing that convenience, getting it where I am, when it's convenient for me, being able to just walk in and get it. And as I said, meaning, being able to get it without an appointment and where you are, almost like, hey, I'm going to the grocery store, and while I'm there, I may get my vaccine, right? And for these reasons, and following that demand data that we've been seeing, the Buncombe County HHS is shifting vaccine operations to better meet that demand and that desire. So first, we're going to be consolidating our 2 sites into 1 site. Our drive-through sites have been hugely successful, but they are subject to weather conditions that we can't control, and we have had to cancel those very quickly due to hazardous weather that was coming. And as demand has decreased from our early days, it's time to merge those 2 operations into a one-stop vaccine shop at AB Tech. And so beginning May 10th, folks will be able to get their first and second doses in the same place. So cut down on some confusion about having to go to a different place for your second dose. And that place will be our AB Tech site on Ferniehurst Drive. Additionally, beginning April 28th, we are implementing a walk-in availability for folks looking to get their vaccine when it's convenient for them. And so we will continue to offer our online scheduler for those who want to make an appointment and have that confirmation, and be able to fast track them when they come into the AB Tech site. But we'll also accommodate walk-in desire during our vaccine business hours, allowing individuals to drop in at their convenience and get their vaccine. And then lastly, the consolidation of the two sites. With that, the needed human resources will be reduced as we go from two to one site, allowing us to build on our successful outreach with additional opportunities, particularly in what I'm calling sort of the small batch approach, so about 100 doses or so for populations that may be at greater risk or have limited access. And these may include and build on some of the work that we've already done with our historically marginalized populations, could be our migrant farm workers, and many other populations with that. And I've listed some examples here, including our homeless, our detention center, our migrant farm workers, our historically marginalized populations. And with that, I just want to recognize that this week marks National Volunteer Week, and I want to recognize all the volunteers in our county, in our region, and our state that have been assisting with vaccine operation and throughout the pandemic response, particularly for those dedicated and compassionate volunteers that assist us at our vaccine operations. The vaccine team and I really appreciate the desire to be a part of our work and the commitment that those volunteers are making. And those are medical and non-medical volunteers doing things from helping guide people as they come into the door, decontaminating chairs, and even putting in the shots. And so I just want to say we are delighted to have them be a part of our team and want to thank them for being a part of this historic event. And then to the public, if you have not received your vaccine, please roll up your sleeve and protect yourself and those you love. We had a large uptake, as I mentioned, in vaccine among our 65-year-olds and above across the state, to the tune that statewide it was 71% of this group being fully vaccinated. And as a result, we have seen a dramatic decline in the new cases among that group. And so proof that vaccines work in stopping the spread. Statewide, we are seeing spread in our younger populations who are unvaccinated. Here in Buncombe, when I pulled the numbers for last week, our average age for our most recent cases is 33 years old. And so please do your part. We can all stop the spread of this virus that has taken so much from all of us. So please help get us back to the things we love. Every arm, every shot is a step toward ending restrictions, ending sickness and death, and ending this pandemic. So please check out buncombeready.org or myspot.nc.gov to get your vaccine today. There is a vaccine for you, and thank you, commissioners, for your time and space to share this update.
Thank you very much. Appreciate it. Any questions from commissioners?
I don't have any questions, but I do want to commend the staff and Health and Human Services and the YMCA and all the partners in the community who worked with the Mexican consulate of Raleigh. I got to visit the site last week, and it was really incredible to see what was happening in there to ensure that our Latinx population did have the opportunity to receive their vaccine. So incredibly well done job for that particular community. Thank you.
Well, thank you for that, and I'll take that back to our team. It was very successful, and we're able to partner with them for about 2 weeks. So thank you for that.
I got 2 questions. The first is, I didn't suppose you knew off the top of your head if and when general practitioner offices might get access to vaccine supply.
So new providers are being added every day. And what that really means is that if a provider's office is interested, going through the CVMS portal and getting approved by the state, and then they become an approved provider and are eligible to get vaccine either directly through the state or through a transfer from someone else who's already getting it. I think the state has opened that up.
Okay.
Has been working pretty tirelessly on that to get that vaccine out. If you have someone in particular or a group that's in particular who's interested, please reach out to me and I can help them get to the right person.
Okay, just because mine doesn't have it doesn't mean others don't, so I shouldn't make those assumptions. Okay, thank you. And my final question was, I recalled Dr. Fauci back in December mentioning, I think he said around 50% he expected, and he was pontificating, that to create a downward pressure on caseloads and be a counterweight, I think was the phrase he used. And I'm not asking you to guess what that number might be, but can you tell based on our trends when we might reach that percentage number looking out over the next 4 weeks in terms of our population?
I appreciate the question, and I don't know that I'll be able to fully answer it for you. I can just use the example of our over 65 population as a really good example for that the more our population gets vaccinated, the more likely we are to see those dramatic declines in new cases within those populations. They've been a really good example of, even before they reached 70% fully vaccinated, we saw dramatic decreases in the new cases amongst that population. And that translated even to a decrease in outbreaks that we were seeing in long-term care facilities as well. And so that population in particular is a great testament to, as we continually get more and more folks vaccinated, we are likely to start to see that as you're vaccinated, you are stopping the spread. Like, you are stopping the spread. And the more folks get vaccinated, the more likely we are to continue to stop that spread.
Okay, thank you.
All right, thank you very much.